Well, good afternoon, everybody, and so excited that everybody is able to attend this meeting. This is one that we'd actually had planned while we were all still going together, meeting together, and so I am so thankful that we're able to do this meeting over Zoom. I also think this is timely as we are moving through the COVID-19 experience in Topeka. So I'm very honored to introduce our Club Rotarian and our Shawnee County Health Officer, who's going to speak to us about what he's been up to and maybe a little bit about what's been going on in Topeka as in general. Gianfranco?
Thank you. Well, good afternoon, everyone. I'm glad to see all of you, even though in 2D and not in 3D like we would be in real life if we were all together in the same room. But it's good to see you're all safe at home and you're still all interested in hearing more information about coronavirus. I can't believe you want to hear more, because if your lives are, well, probably your lives are not very close, similar to mine right now, but I suspect you get a lot of news and information about coronavirus already these days. But I'm going to try to share with you some information that maybe you will find relevant, because it's more related to what's happening in our own community. As you all know, we are in the middle of a pandemic, and what a pandemic is really a combination of three things that happen at the same time. One is that there is an agent. Most of the time it's a new agent, and most of the time it's a virus, like in this case, that is being transmitted from person to person. So human transmission is one of the three criteria. The other is that this agent will cause disease. And the third criteria is that it's going to be just about everywhere. That's what makes a pandemic. And that's why there was a little bit of confusion at the beginning, because the World Health Organization had not declared a pandemic yet. The reason is that not all three criteria had been met immediately, but when they were met, especially the geographical distribution, then a pandemic was declared. As you know, it started in China. It's a little unclear when exactly, sometime between December and January. In late January, it had reached Europe, and the first recognized, that's an important one, the first recognized cases in the United States were in late February. But we know now, going back with some serological and autopsy reports, that probably the virus was already circulating at least in some communities in California as early as the beginning of February. The first cases in Kansas were in late February, and the first case in Shawnee County was not until the end of March. And since that time, essentially, I have been working two full-time jobs, because being the county health officer is only my secondary job, and something that I do ordinarily with, being essentially available for the health department when they have questions and assisting them with some activities, meeting with them maybe once every week or two. This whole thing has changed really the way that we run our lives and the way that I interact with the health department as a health officer. But before I tell you what exactly we are doing, I want to go back to a movie that probably some of you have seen, the movie Outbreak. If you haven't seen it, I don't know if you want to watch it now. I mean, this may be the wrong time for a movie like that, but I suspect that many of you know what I'm talking about. It's a typical Hollywood movie where there is a new virus, I believe, if I remember right, that takes hold in a certain city or town, and all the drama you can imagine from Hollywood takes place there. The National Guard comes in and cordons off the town. They're going to start shooting people who want to leave the town. People are starting to shoot other people that they think they're responsible for the outbreak. Just law and order totally deteriorate until the federal government comes in full force. The CDC, the Centers for Disease Control, they find the vaccine within weeks, and they send their people down into the town, they start injecting the vaccine, and everybody's safe and happy. That's not exactly how things are working now, isn't it? For one thing, we are not shooting each other, thank goodness. We are forcing people, in some cases, to stay at home. We are inviting everybody to stay home, and we are forcing people to stay home in some cases with individual orders when we know they are infectious. We don't need to shoot them. We don't need to put them under arrest. But the other big difference is that society is still working at a crawl speed, but there isn't been a total fall down of our rules in our society. You know, we can still go to our grocery store, we can leave our house and, excuse me, being reasonably safe. And then there is another big difference, that the federal government didn't come to rescue us. And what I mean by that is that the CDC didn't really take over our outbreak. CDC, the Centers for Disease Control in Atlanta, of course, didn't come to take over our outbreak and say, hey, we are going to fix it for you, and by the way, here is the vaccine. That's all Hollywood, number one. And number two, that's not how public health works in this country. There is something called, I'm sure that many of you will recognize it, the 10th Amendment to the US Constitution, that says that, I'm paraphrasing, all the functions that are not indicated and identified in the Constitution of the United States as belonging to the federal government, by default, they belong to the states or to the people. And nowhere in the Constitution is there any mention of public health as being one of those functions. So by default, then public health belongs to the states, right? That's what the Constitution says. And many states actually push it down, push the function down to even a lower level, lower in the sense of being closer to the people, to the communities, which is in Kansas, county health departments. That's why the CDC doesn't come to rescue us, because it's really not their job. Now, the federal government obviously has a job in this, coordination, recommendations, providing resources, supporting what states and locals do. But it's not the primary function, it's not a primary function of the federal government to deliver public health services. In Kansas, like in about half of the states in the United States, the function belongs to local health departments. And for Kansas, that means county health departments. And those departments and their health officers have a pretty big role. So what the state law says is that each board of county commissioners also acts as a board of health, which may come to a total surprise to you, but more interesting, comes to a total surprise to new county commissioners many times who are elected and run for office to be a county commissioner, and then the first day on the job, they say, oh, by the way, you're also a member of the board of health. I'm what? What's the board of health? They have no idea. But it is important because the state law says the Board of Health is really the one who has the power, the authority, and the responsibility to take all necessary actions to assure the health of our communities. And the law also says that the Board of Health will appoint a health officer to carry out those activities and those precautions and those measures. In cities greater than 100,000 people, state law requires that health officer to be a physician with training in public health. And that's why I'm here, because Shawnee County, of course, has more than 100,000 people. And there is only a handful, as you know from knowing the state of Kansas, a handful of counties where that's the case. Everywhere else, the health officer is usually the director of the health department, which may or may not have a training in public health, and the training may or may not be an advanced training. But the power that is given to the health officers is really big. And it's something that's quite unique in the sense of, if you think about it, that's not an elected position. I'm not a sheriff. I'm not the chief of police, although the chief of police is also not elected. But I have the power to tell you, you have to stay home. You can't leave your house. I have the power of shutting down schools and restaurants and businesses. Preventing mass gatherings. That's huge. That's huge. And yet it's something that was built into our laws at the time when infectious diseases were killing a lot of people. Those laws were drafted about 150 years ago, when you still had polio, you still had smallpox, you still, that's what people were dying from, right? It was most infectious disease, tuberculosis. It's ironic because for one, and some of you may have heard me making those statements when, before this crisis of a pandemic, I was going around and giving talks about public health in Kansas and in the county, and one of my talking points was, what kills people today is not infectious disease, it's chronic disease. It's the hypertension, it's diabetes, it's poverty, it's social factors, it's cardiovascular disease. But even kill a lot of people in position. However, I must say that what's happening today was not totally. Can you hear me okay? Because I got a message, my connection was not stable. If you can't hear me, please let me know and I will pause or do something else.
You froze there for a moment, but You're back.
Okay, good. I've been working in public health for about 35 years now in different roles, including at some point I was a state epidemiologist with the State Department of Health and Environment. And that was during the 9/11 emergency, and I'm sure that many of you will remember the anthrax scare that followed that emergency and all those white powders that were found everywhere to scare people and so on and so forth. And there was a lot of concern at that point that a pandemic could take place, either man-made as an intentional act of bioterrorism or caused by a natural agent, which seems to be the case in the case of this coronavirus. And we tried to ring the alarm bell so many times, and we tried to say that to everybody was willing to listen, but nobody really listened. Some people heard us, but there was really little action taken, except for taking money away over and over again from public health. So when people say now, nobody could know, nobody would have known that something like this could happen, I'm sorry, that's not true. There's a lot of us who were not paying enough attention. And I'm not saying that to make anybody feel bad, but I do have a big plea for all of you today and all of our community. Please don't forget public health. Please don't forget public health. Those people, and I'm not talking about myself. Honestly, I have the easy job. I sit in the safe and comfort of my office here in Topeka, reading documents, making recommendations, and telling people what to do. The people who are doing the hard part are my nurses at the health department, who are calling each and every one of those 94 people who tested positive in Shawnee County, have long and lengthy interviews with them, within hours, by the way, from the time we received the report, and ask them, go back 14 days from the date that you were diagnosed. Who were you in contact with? Now think about it. Try to think all the people you were in contact with in the past 14 days. Now, it may be a little easier now because you're all staying home, right? More or less. But under ordinary circumstances, that's not an easy task. And then they're calling each and every one of those people that we call close contacts to tell them, you've got to stay home. If you get sick, these are your instructions. You call me. I will tell you what to do, where to go to get the test, and so on. They're working 12 to 15 hours a day, 7 days a week. Lab reports come in every day. There is no Saturday, no Sunday. They are processed within hours, not days, within hours. Those are our heroes. And we need not forget them when this crisis is over. Because here is what I call the curse of public health. And now I'm going to start some sharing on my screen and see if that works. Okay, I hope you can see. Can you all see these charts? Is it visible enough? Nod if you can. Okay. So look at this red line. This is the red. Let's talk about this pandemic. This is what would happen if we did nothing, right? The pandemic starts here, and then the number of cases goes up and up and up. And if we do nothing, it will skyrocket. It will become what we call exponential growth, which means the number of cases will double every 2 or 3 days. That's a horrible situation to be in. You have number of cases double. However, we are more on the green line because we did something, right? We closed our schools, we closed our business, we closed our restaurants, we told people finally to stay home for several weeks. We did a lot. So as a result of that, we are not going to be on this red line trajectory, but we are going to be in this green line trajectory. And this is where we are right now, where it says warning. Because we are close to C, this part in the blue box. C wasn't that bad, we overreacted. And that drives me crazy. I heard that no longer ago than a few hours ago in a meeting with public elected officials. And my point was, the reason we are on this green line is because we did something. If we hadn't done anything, we would be on the red line. So when you read back, people go back to the first estimates of mortality that, were based on models, and people were saying, if we do nothing, we may have 2 million people who die from the disease just because they're killed by the disease, and possibly another 2 million will die because they could be saved, but we don't have enough ventilators and ICU beds for them. And now we're talking about maybe having 60,000 people dying in the United States. Now, first of all, that's still a lot of people. But I understand 60,000 versus 2 or 4 million, it's a big difference. But the reason we are having only 60,000 is because we did all that we did in terms of social distancing and control measures. So it's important to keep these things in perspective when we make our projections and we say, see, it wasn't that bad. No, it wasn't that bad because there were people, because they were our heroes in healthcare who were treating patients in and out, and they were our heroes in public health that did the work that they did. That's why it wasn't that bad. So what is the work in public health looking like these days? I told you about the case tracing and content investigation. That's really the big part of it. My job personally is primarily to monitor the spread of the disease in Shawnee County. And I do that by looking at the number of cases, of course, but also by looking at some different things. How many lab reports I receive, how many lab tests are done in the county. We know more or less how many lab tests are done in the county. What proportion of those tests are positive? When we have new cases, do we know how these people were infected? Or are they coming out of the blue in the community? Because in the first case, if we know how people were infected, we know. And some of those people may be people that we asked to be on quarantine because we had identified them as close contacts already of someone with infection. But if I receive 12 cases in a day and almost all of them are just coming out of apparently nowhere, what that tells me is that we still have a lot of virus circulating in the community, and that we still have a lot of work to do. And then there are other things we look into. How long does it take for somebody to come down with symptoms and being identified and isolated? I want to give you some positive news today. All those numbers are going in the right direction in Shawnee County. And that's not an indication that we overreacted. That's an indication that we did the right thing, and what we did is working. Because I can guarantee you there are other counties in Kansas that are having a very different experience. Because they don't have the luxury of having the kind of staff that we have at Shawnee County, or having a physician with training in public care. I'm sorry, I'm not bragging, and I know I may sound like I'm coming across as an arrogant doctor here, but I'm just being realistic. I know how public care works in Kansas. I know those health departments. They have all my support. I'm not trying to badmouth anybody. They simply have been neglected for decades, They don't have the capacity to do the work that we are doing here in Shawnee County. Well, we have been preparing for something like this. Because we are a larger county, we have more capacity. I told you that we investigate every case within hours. I can guarantee you that doesn't happen everywhere in Kansas. It just doesn't. And when you don't, then you have people being infectious walking throughout the community, infecting other people. So that's part of what I'm doing, looking at those numbers and making sure that we can be safe when we decide to relax some of these measures. And so let's talk a little bit about those measures and what's ahead of us. So I told you the good news is that the numbers are doing well. With some caution, the caution is it can change like this. It really can change like this. All it takes is for people to start becoming tired and starting to say, you know, look, we had no cases in the last 2 days. Why am I still at home? I'm going to go out and play soccer with my friends. Next thing we know, we have a bunch of cases coming out of apparently nowhere. And then we are all going to be stuck at home as a result of that for another week or two. So things can change. But what I've been observing right now is pretty good. So we are putting together a plan that includes a time frame for how we can release some of the restrictions, or actually eventually all the restrictions that have been in place in the last few weeks. Nothing will happen for as long as we have a statewide order, as we do now, to stay at home. And that order is scheduled to expire on May the 3rd. Although what happened yesterday with the legislature not coming back in session to extend the declaration of emergency that was done at the state level, that declaration of emergency expires on May the 1st. So if that is not renewed, a couple of things happen. First of all the executive orders that the governor has issued are based on that declaration of emergency. So immediately they will all become null and void. That's May the 1st. The second thing that will happen is that we will lose probably billions of dollars, certainly hundreds of millions of dollars in federal aid, because the federal aid will come only if the state has a declaration of emergency in place. So at some point between May 1st and May 3rd, we hope that the governor's order will be lifted or made null and void because we have no declaration of emergency. And that's when we will have our authority back at the local level to do what we need to do to control the spread of the disease. Because when I told you that it's a decentralized system, it's done at the local level, but the primary responsibility is still with the state. So the state delegates that responsibility under ordinary circumstances to the locals, but the state can also make decisions at the state level, as the governor has just said and done in the last few weeks. So those state orders take priority usually on local orders. The first thing that we will lift is the stay-at-home order and the order to close all businesses, except for those that are considered essential. So essentially, we'll be able to leave our homes and people will be able to go back to work if they have a job to go back to, with some exceptions. And those exceptions will be clearly identified and listed. And those exceptions are because they represent high-risk businesses where there is a lot of foot traffic for customers, and there is, just for the nature of the business, there is more risk of transmission. Because one important principle that we want to keep in mind in this process is that it's going to be a prolonged process of lifting the measures. It's not going to be like opening the floodgates and let all the water through. It's going to be more like slowly opening a faucet and having a trickle of water and then adjusting the volume of that water depending on what we observe. So we don't want to have all those restrictions lifted all at once, because then if something bad happens, and I can almost guarantee you it would happen, we don't know if it's because we let restaurants reopen or swimming pool open or we had big gatherings allowed or none of the above. So we need to take things slowly, in a deliberate fashion, probably in 2-week intervals. And the reason for the 2 weeks is because that's the maximum incubation period of the virus. So if we lift, let's assume that we lift, it's just an assumption, the stay-at-home order and the business closure on May the 3rd, Then we will count 2 weeks from the date. 2 weeks later, throughout that period of 2 weeks, we monitor the situation. 2 weeks later, if nothing bad has happened, then we lift some more restrictions. And then we wait another 2 weeks. In some cases, we may even have to wait longer than 2 weeks, just to allow enough time and be absolutely sure that we can move to the next phase. So that's really what you can expect in the next few weeks or months. That's all the good news, I would say. Now, I do have some news. I don't know if I would call them bad necessarily, but I want to be realistic. And I don't want people to have false expectations. The first thing is that this virus is going to stay with us. Just because we have had fewer cases in Shawnee County right now doesn't mean that the virus is going to go away. It's not going to go anywhere. And remember, we are seeing fewer cases because we are doing everything that we have been doing. But I have no doubt that once we start lifting those restrictions, there will be some more cases. And we are ready for that. So that in and all alone wouldn't be a sign of failure. That's why I want to make those expectations clear. We don't expect to lift all those restrictions and see no additional cases, no new cases. There will be some cases. But what I do want to see is that those cases will be in a relatively low number that can be managed by our public health force and by our healthcare system. So that our hospitals will be able to treat those people, admit them if necessary, transfer them to ICU, intensive care unit if necessary, and put them on a ventilator if necessary. And our public health people will be able to do all the testing that they need to do to identify additional contacts and potentially infected people. But yeah, don't expect that the number of cases will remain low. It will go up. The virus is not going to go anywhere, which takes me to the second element, which is the most, well, I don't know if I can say most probably. It is possible. And there are more and more models that show that we are going to have a recurrence of the virus, a resurgence of the virus in sometime between the fall and the winter. And what that means is that we don't know exactly what that recurrence or resurgence will look like, but it is possible, and some people are starting to say it is likely that we may have to reimpose some social distancing and community-based social restrictions, social gathering restrictions, or we will end up in situations even worse than what we have experienced now. And that may last for a long time. They may last probably through the winter. One reason for concern is that they will overlap with the regular influenza season, which already, even before the coronavirus, was taxing in some seasons, in some cases, our healthcare system. And so we don't know what it's going to do together with the coronavirus outbreak. So it's a little early. I don't want that to spoil the joy of the fact that, things are improving, things are going better. We may be able to leave our homes in a couple of weeks. But I also want people to have a realistic sense of what they can expect. The last thing I want to say in terms of perhaps longer term impact of this outbreak. One is at the local and national level, and the other is at the international level. I don't think that enough people fully realize what the long-term impact of this outbreak is going to be on both the health and the social issues that affect health for our population, particularly for our disadvantaged population. Already in Shawnee County, we have about 38% of our reported patients for coronavirus who are African American. 38%. Against the population of African American, I think between 10 and 12%, depending how you count it. So clearly a disproportional burden for our African American population. In the longer term, the reason for that, there are probably several reasons, but perhaps the most obvious reason is that we know that certain individuals have pre-existing conditions that make them more susceptible to having a severe disease with coronavirus infection. African Americans tend to have a lot of those conditions more than other race, ethnicity, and social groups. So then that in and of itself may explain that entire differential proportion that we see. Maybe there are other factors we don't know for sure. But that leads me to the second concern that I have in terms of long-term consequences. All those chronic conditions, remember what I said earlier, that I was preaching that chronic disease is what kills people and not acute infections. Well, those chronic diseases are still there. They didn't go anywhere just because now we have the coronavirus. So people still have to manage their diabetes, their hypertension, their heart disease, their strokes. Those things are still there, and they're probably still killing, not probably, they're certainly still killing people, except that now they are unchecked and unmanaged. Because it's almost impossible, not totally, but it's very hard for people to have that chronic disease managed appropriately in the current circumstances. So my concern is that in a few months, or perhaps over a period of years, we're going to have an increase in deaths from those chronic conditions that now are not being managed appropriately. And the last element is going beyond our country. And, this is a pandemic, as I said. If nothing else, should be a reminder of the fact that what happens in Wuhan, China, is going to affect Topeka, Kansas, one way or another. I fear that we haven't seen the worst of this pandemic because we haven't really seen a lot of it taking place in developing countries. But some of you may know, I did spend a few years working in developing countries and in Africa before I came to the United States. And in fact, my wife Flora and I were just visiting Ethiopia a few months ago. And I can't even imagine the effects of a heavy infection rate of coronavirus in those populations where healthcare is at levels that we can't even compare to anything we have in this country. People's access to that healthcare is very low or non-existing. People simply can't stay home. It's a luxury. All of us, I believe, in this call today, judging from the pictures, we are all calling from home. There's a lot of people who can do that in this country already, but I can guarantee you, people who live in Mexico City, I'm just taking, one of the largest metropolises in developing countries or underdeveloped countries in the world, in São Paulo, Brazil, in Bombay, India, they have to leave their houses. They have to they have to find food. They don't have stock food that will last them for a week. Every day they have to go out to find some money and find some food. Social distancing is a first world issue. It's not going to work in the third world. And I don't think anybody really has any idea what's going to happen there until it happens. So I hope I'm doing okay with time. Let me pause here. And I don't know, I haven't joined one of these Zoom sessions with the Rotary yet, so I don't know if you want to have questions, with the microphone or in the chat box. Just tell me whatever I need to do.
People are, actually Grant has one in the chat box already, and then people will just go off mute and ask a question.
So Grant's comment is, I strongly support your good work and sincerely appreciate the hard work of your staff. Even if we can have social gatherings, is it wise for Rotarians over 65 to gather in a meeting before there are vaccinations?
Thank you. That's a great question. I'm glad you asked. What you will see most likely when we release our pathway back to normal, you will see, as I said, it's going to be a gradual, stepwise approach, and you will still see strong recommendations for people with high risk, and that includes everybody 65 or older, so unfortunately includes me too, but people with underlying conditions. In the first several weeks, we recommend that they really stay at home, just like they're doing that now. And then once we feel more comfortable, we have the virus being monitored, we know that there isn't a big spike in the transmission of the virus in the community, then slowly they can come out of their homes. However, I think I would still urge a lot of caution for people who have high risk of severe disease. I can't really address a specific question. Should we meet in a room at the Capitol Plaza? I don't know yet. I would be happy to give you my advice when the time comes for those meetings to resume. But I think it will be at least several weeks after we start lifting those restrictions before people with high risk conditions will be told, yes, you can leave your house and be safe, or reasonably safe. Remember, there is not going to be anything like zero risk for coronavirus. Not until we have a vaccine, and even then, who knows if we can go down to a zero risk. But the virus is with us, and will stay with us for the foreseeable future.
Dr. Pezzino, I want to echo Scott's thanks both to you and to your staff of nurses. I know they are doing an incredible job, and I think that you're doing an incredible job of keeping us all informed. In your estimation, what is the probability of this virus then mutating and coming back in a different form that once we do have a vaccination for it, will have to be updated on a yearly basis?
Thank you. That's a great question. Thank you for your support, by the way. I really appreciate it. As well as the support from everybody who has let me know, and they're still letting me know how much they support the public health function in these difficult times. I may not be the best person to answer the question. I know that there are virologists and microbiologists who are working very hard to understand this virus behavior a little better. What I know is that there have been already some mutations in the virus, but they haven't affected the virulence of the virus. What that means is the ability of the virus to cause disease. People who are developing the vaccine, of course, are aware of those mutations and the possibility for those mutations. What you are describing, of course, is the scenario that we have for the influenza virus, where we know the virus mutates so much and there are so many different strains. And here we need to develop a new vaccine, trying to guess what kind of strains will circulate the following season, and then we need to repeat the vaccine. It's a very imperfect system. I think this pandemic is another wake-up call that we've got to develop a stronger and better system to make vaccines. Problem is that there is probably not a lot of money to make there. And in a profit-oriented society like ours, frankly, where development of these interventions and vaccines is left primarily to private investors, with a lot of input from the federal government, but still a lot of role for the private investors, they may or may not happen. So the short answer to your question, I don't think anybody knows at this point. It's not something that can be ruled out, but it's also not something that so far we have seen happen. The virus already has some time to mutate drastically and turn into something quite different, and that hasn't happened yet. So I think that that's perhaps encouraging.
Another question we have from Richard Ross is, could you discuss testing? What is needed? How is Shawnee County doing? Do we have enough supplies?
Yeah, let me bring up real quick a table that I have here. So I'm going to share my screen again. Let's hope it works. Okay, so I hope you can see this table. This is based on data from the Kansas Department of Health and Environment. And the interesting thing, perhaps, to address your question is the column on the right, which is rate of testing per 1,000 people. So essentially, how many tests we did for every 1,000 people who live in our county. And you can see here that we are in the top 3. in the top 3 are very close to each other. So there would be 7 Ward 1 in Shawnee County. The average for the state is not shown here. I believe is about 6 per 1,000. And then you have large counties like Sedgwick with not even 5 per 1,000 people. So all that to tell you a couple of things. That first of all, we are doing more testing in Shawnee County than in most other counties in the state, and that's great. The reason that is happening is because we have a good, strong relationship between public health and our healthcare providers in our 2 hospitals. I am in constant contact with them. We have weekly calls with our 2 hospitals, and we have a lot of emails that get exchanged between the hospitals and us in between calls. I've sent multiple emails to all our providers that are licensed to practice in the county. And in the last 2 weeks, I sent emails particularly to tell them, let's test more. We need to test more. Let's test more. And so we actually relaxed our criteria for testing sooner than the state did. The state just did that yesterday. And we did that 2 weeks ago. And we said, everybody with cough and fever should be tested. Let's do it. And I know that they're doing it because the number of tests that we did went up. The good thing is that the proportion of those tests that was positive didn't go up. So what that tells me is that we are testing more, but we are not finding many more cases than before. So that's a good indication. Again, it's one of the indicators and measures that I look at to monitor the spread of the infection in our county. Now, are we where we want to be? No, absolutely not. Moving forward, especially if we want to lift as many of those social distancing measures as possible, and especially if you're going to have a recurrence of the virus, we are going to need to test many more people. We are talking of hundreds of people every week just in Shawnee County, several thousand people throughout the state, millions of people throughout the country. And the infrastructure is just not there yet. You hear the same promises that I do here, right? The tests are there, they're on their way, they will get it, you will get 1 million tests next week. Well, we haven't seen that yet. It's an unfortunate chain reaction where it's not just having the test kits in a laboratory. It takes more than that. It takes enough laboratories to process the tests, and it takes enough collection kits to collect the specimen and send it to the library. Right now, that's what's in very short supply is the little swab. They look like cotton swab, but you can't use a cotton swab, unfortunately, for that purpose. That people use to collect a specimen and send it to the lab. So, in summary, I think we are doing okay in Shawnee County. We are testing more than almost everywhere else in the rest of the state, but we definitely need to do more.
Larry, you have a question?
Yes. Dr. Pezzino, let me just reiterate what people have been saying about Shawnee County and what you've been doing. I work for a company, VenueWorks, which is 21 different accounts across the country. We have bi-weekly meetings, and they are nowhere near the information that we're getting from you and the folks in Shawnee County and Kansas. So thank you for that. My question is, people are talking about May 3rd and the lack of social distancing or the ramping back up when things happen. But realistically, we as venues are thinking that it's not going to happen in the next few weeks, maybe not even in the next few months, because once buildings are open and come on back and see the shows and whatnot, there will be the fear. There will be the where's the vaccine, and we're even hearing in some of the states that we represent that 2021 is when buildings are going to be reopened. What, if anything, have you heard, or what do you know from the health standpoint about public assembly facility venues?
Yeah.
In our case, Expo Center and Topeka Civic Theater, Jayhawk Theater, and Topeka Performing Arts Center.
Right. Well, first of all, again, thank you for your support. Very much appreciated. One thing I neglected to mention when I was talking about how I spend my days these days, and it's the public communication function. We take it very seriously because, again, we are not in that movie, right, where we can send the National Guard and shoot people who are not in compliance. Ultimately, it is our own decision individually whether we're going to open that door and leave the house or not. And the only way for that decision to be the right decision is for people to have as much information as we can provide them and justify our recommendations as much as we can. So I spent a lot of time in public communications. I'm glad to hear from you that has been recognized as an important function. Now, to your question, what you will see in our pathway to going back to normal is, again, a stepwise approach. So at the beginning, the size of gatherings that are going to be allowed is going to be very small, probably 50 or less. And we're talking the first few weeks. And then, as usual, as I said earlier, we will monitor. If nothing bad happens, we will increase that from, 50 to something else. And then a few weeks later, we'll increase it. Right now, I hope that by the end of July, we may be able to say that gatherings of any size may be allowed, provided that if they are above a certain size, and again, all those numbers still need to be decided, they need to submit the plan to the county that will describe how they're going to keep the event safe. So, in other words, we're going to establish, what I'm trying to do is here to establish some general principles of good social distancing and good control and mitigation for the effect of the virus that then we will apply to specific situations. And we're going to ask the organizer, the people who are contemplating or organize those events, tell us how you think your event is in compliance with those principles. And then let's talk. Let's have a conversation. Look, the last thing we want to see is to cripple the economy in this county even more. I mean, I said that before in public, and I really mean it. I know personally people have lost their job. I couldn't feel worse about that, and knowing that they lose their job because something that I or we in public health decide. So that's really the last thing we want to do. I'm also very well aware that there can't be a strong, vibrant economy if people are sick or if people are afraid of going to the events, because that's the other big variable. Are people need to feel safe enough to do the things that we are telling them, you can do it. And I already hear people say, you know what, I'm going to stay home for, I don't know, for how long?
Forever.
But it's a joke, but it's not a joke in the sense that the virus is probably going to stay here. I don't want to say forever. I don't know what ever means, but for the foreseeable future. And so when you say 2021, that's not unrealistic. That same date that I hear is that, hopefully that's also the date by when we may have a vaccine available. And again, available then for whom? Is it for everybody? Is it going to be enough? But, that's the date by which perhaps, just perhaps, we will have enough people immune in our communities between the vaccine and natural infection that many activities can be considered safer than they are now. But it's not unrealistic to think that that's going to be a very prolonged period. So I think what we need to do is to find a balance of risk that we all feel collectively is reasonable. Because there is not going to be zero risk. It's not going to happen. But we also can't stay at home forever. We just can't. We need people to be productive, to get out. We need people to not fall victims of depression and alcoholism and substance abuse or domestic violence, because that's what happens when you trap people at home for an extended period of time. We need to be able to tell people it's reasonably safe for you to get out, and you can make it even safer if you do the following things. And we need to specify what those things are. But ultimately, it will come down to a personal decision of each of us to feel safe enough to do certain things or not.
Well, I appreciate that, and I wanted to ask you this because there are so many businesses affected, and certainly in public assembly facilities, we are not a priority we know are not essential. And I just wanted folks here on Rotary to understand that this may be several months, not just days or weeks. And when we get back to normal, what will that new normal be? Thank you.
Yep. Yeah, very good point. Thank you.
We're running out of time, but we do have a few more questions that I hope we can address. One is, what's the best resource to stay informed and know the current rules?
If you want information primarily for our community, I would recommend you go to the Shawnee County Health Department website, and it's you can access that from the Shawnee County site. It's shno.us, I believe. I'm not 100% sure. If you Google Shawnee County, yeah. And then there is right there on the homepage, there is COVID-19 information. That's where we keep all our background documents, we keep our orders, we keep our recommendations also from KDHE, the State Health Department, the CDC. If you want more of the big picture, the bigger picture, I would recommend either KDHE or the CDC, and they often have overlapping documents. KDHE is more focused on Kansas, of course, and CDC is more focused on the entire nation.
Another question, and we just have a few more minutes, but I want to get everybody's question answered, is how are the nursing homes in our county doing?
We have been really concerned about our nursing homes since the beginning because, if nothing else, just remember how this entire thing became public in the United States is with a bad, ugly outbreaks in the Seattle area that really made a lot of victims, and we just didn't want to repeat that in Shawnee County. We know how devastating this virus can be if it starts sweeping through a nursing home, and then it will infect almost everybody among the residents and the staff. So what we have done, we have appointed one dedicated person in the health department whose main task is to keep connections with nursing home and other long-term care facilities. And this person has regular calls with them. We also have a web form that we have used for them to report anything unusual to us. We have had a few cases in nursing homes that were able to be, at least so far, contained. I don't know what else to tell you. I mean, I am still worried. I'm not ruling out that we are going to see an outbreak in a nursing home in Shawnee County right now. I think we've been very lucky that we haven't seen it, quite frankly, because it's a perfect incubator for severe disease. It's, by definition, these are people with underlying conditions, either because of their age or because of some other diseases that they have, and they live in close proximity. There is no way for them to practice social distancing. It could become really bad, but so far we haven't seen that happening in Shawnee County.
Thank you. And Grant, you want to ask your question? You have some big words in there that I can't pronounce.
Yeah. Okay, actually it's from Donna.
Okay, Donna, better yet.
Okay, so I was curious about the home testing kits that I've been reading about, that maybe for $100 you can get a home testing kit. And my understanding is that you need a nasal pharyngeal swab, which I'm a nurse and I don't think I could do that to myself. So I don't know if that's what those kits are, it's something different, or what your opinion is about home testing.
Actually, from what I heard, it says nasal, not nasopharyngeal.
Okay.
That's what I think. That's what I heard. I haven't seen the test. Of course, the information was released just a couple of days ago. I don't know if the test has already been distributed or not. It is essentially the same test, my understanding. The same test is done currently by laboratory, which is called PCR, which essentially what it does is detecting viral particles in the nose or in the throat of the people that are subject to the test. It's a good indicator for current infection, and actually not even for current infection. It's a good indicator for whether the virus is in your nose and throat or not. But if you don't find the virus in your throat and nose, it doesn't mean you don't have the infection. It may be that you're still incubating the infection. but the virus hasn't replicated yet to your nose and throat to a point where it can be detected. So I think anything that can improve the number of tests is more than welcome. I just hope that the test is going to be used in an appropriate way, in a safe way, so that people don't start using it to find answers that the test itself cannot provide.
And then we'll have one last question from Chris Palmer.
Thank you, Dr. Pezzino. One thing that I'm still confused about the testing and everything is testing. If there were unlimited tests and those were available, would everyone who just wants to drive through and get one? Or would we still you need to have some type of symptoms, which it sounds like it's what we're doing now. And isn't that just a snapshot of right now that you don't actively have the infection, not if you have had it and gotten over it, or that you won't get it tomorrow? So I don't know, explain to me if you could, as best you can, I know that you're not an oracle, but how more testing availability, it sounds like at least in Shawnee County, we're testing people who have any symptoms at all. Would it be that everyone can get tested, like everyone should be tested regardless of your symptoms? And what good does that do 3 days from now if I'm not positive?
Yeah, that's a very good question. Honestly, I'm thinking about the question myself. I'm still doing some studying and reading to try to understand how exactly we would use all those new tests that are made available. But I can already imagine a few circumstances under which I would love to have the test right today. Your scenario, people just driving through and say, hey, I want to get tested today. I have a couple of hours before I go home. Let's get a test. It's been done in some countries. I don't know, honestly, how helpful that would be in the current situation. Maybe it would be. Maybe somebody would be able to convince me that it is helpful. I don't know. But I know where it could be helpful is for people who have already some risks, and we need to know if they are infected or not, or even better, we need to know if they are contagious or not. I don't know if any of you have gone to a doctor's office in the last few weeks, but they take some history and then they measure the fever. Wouldn't it be better if they could do just on-the-spot testing within 15 minutes, if you are infectious or not? And if you are, bingo, you're put in isolation right away, and the public health nurse will take all the information and find your contacts. Then your contacts will receive a test right away. And if they're negative, they're still told to be on quarantine because they need to stay on quarantine for 14 days. And then during those 14 days, they will be tested every 3 days. So instead of waiting for them to become sick to a point where maybe they become so sick that then they have to go to the hospital, we can catch them because the test becomes positive a couple of days before symptoms appear. Catch them early enough where they can receive adequate care and be isolated immediately. So those are just two examples. But as you can imagine, we would need many times the number of tests we have now to be able to do that, because you're right, it's just a snapshot. And right now, the snapshot we get is not even a current snapshot, it's at least a couple of days old, because that's the return time for the test results to come back to us. But I am hopeful that if there are rapid tests, and when I say rapid, it means that you can get the answer in less than an hour. And in some cases, I see promises, in 15 minutes. And if they are available in large quantities enough, we will be able to promptly identify many more contagious people, including those that may never develop symptoms, and we will never find otherwise. But just because they walk into a risky situation, we decide to take the test. Say, hey, guess what? You are positive. What? Wow, I didn't know that. Okay, now you are isolated for 10 days.
Dr. Pezzino, are there certain things that we can be doing to let our public and elected officials know that we are supporting our public health experts? It's becoming more and more public.
Interesting that you asked today, because I was just in a meeting this morning that made me think that perhaps some of our elected officials hear primarily the loud voices of what I think is still a minority of people who feel like what we have been doing is excessive. And so I'm not asking you to lobby or anything like that because it wouldn't be appropriate for me. But I'm saying if you feel that the work that public health in Shawnee County is doing is good and appropriate, please let your elected officials know. And the most critical ones are the city and the county. And perhaps between the two, if you want to write only one letter, I would probably go with the county. And the reason is because, remember, they are the Board of Health. So I work for them. I work for the 3 county commissioners. They hire me on a contract, and they can fire me anytime. I'm not suggesting, please don't misunderstand me. I didn't receive any threats of impending being fired or anything like that. But I think they need to hear the voices of their constituents, because what they're hearing now are the voices of the people who are concerned about the economic cost of what we are doing and the liberties that are taken away. All very valid answers, don't get me wrong. But I hope that what we are trying to do is showing people that we are trying to balance both. And so if they can hear, if those elected officials can hear from those of you who support us, I think it would be really important.
Okay, thank you. There are a couple of other questions on chat. If you want to take a look at those.
I really have just one more minute before I have to jump off.
Right. And so, unfortunately, Wayne will get your answer. Get back to you.
Okay, why don't we do that? Since if you have some more questions, send them to me. I'll see what I can do, maybe to send an email to you and you can distribute to the members.
Great, thank you. I want to share with you that we have family members in Brooklyn, New York, and we are so proud.
Are they okay?
They are okay. They live in a very small apartment with 2 teenage boys, and they are managing. But we're very appreciative of the action that you took, and we share that with lots of people because our numbers are low relatively, and it's because of the action that our leaders like you took. Our schools were closed before the New York schools were, and just that example alone, I think, is an example of the great leadership we have, and we're very appreciative of that.
Thank you, Johnny. I hope it doesn't turn into something like the president taking credit for the economy going well, and then when the economy goes bad, it wasn't my fault. So I appreciate what you're saying, and I like to believe that what we did had an impact in the course of this infection in Shawnee County. But by all means, there are many other factors there. So please don't expect that we can make miracles, because we can't. And there will be more infections, and there will possibly even more deaths. I hope not, and I hope very few. But we are not out of the tunnel quite yet. But thank you for your words. I appreciate that.
I'll keep that in mind and be modest about that. I do want the club to know that as the executive committee early on was making decisions regarding meetings and that we did call on Gianfranco to assist us with those decision makings, and we will continue to do that. We will continue to have Zoom meetings through May 14th, and I anticipate we'll have some after that too. And we're trying to figure out a way that the higher risk people can continue to participate in meetings once we do resume face-to-face meetings. Lastly, next Thursday, April 30th, we're going to have a BYOB party. Allison Marker and Marie Pico are setting up the structure for that. That will be via Zoom, and we will let you know how it's going to get played out. So we're looking forward to that. I'm very excited about our May 7th meeting, and Gianfranco, you may want to make sure you get to that meeting. We will be meeting with the Harlem, New York Rotary Club, where we wanted to talk to people who have really been in the middle of it, and see what it's like and what they're doing. And so they'll have some of their members presenting, but also other members participating as observers. So we're very excited about that. I think Marie might be gone. I'm just seeing her photo. So, oh no, there she is. Great. So let's unmute and say the four-way test +2. Remember the last one is it kind? So with that, let's say, is it the truth? Is it fair to
all concerned?
Will it build goodwill
And better
All
friendships.
friendships.
Will it be
Beneficial to all
All
concerned.
concerned. And is it
Will it be fun? And is it kind? Thank you all, and thank you, Gianfranco. And I look forward to partying with you all next week. Take care.
All right. Thank you all. Thanks for the opportunity. Bye.